Welcome to the Global Impact Charity Voices series, a way for you to connect with the charities and causes you care about most.
In this Charity Voices episode, we hear from UNICEF USA about their work to provide water, sanitation, and hygiene services, or WASH, to communities around the world. This is a core part of their mission, but is even more important now during the COVID-19 pandemic. Enjoy.
Hi, my name is Teresa Connor. I'm the Senior Director for New York with Global Impact. Today, I have the pleasure of continuing our Charity Voices series with a conversation with Global Impact member charity, UNICEF USA. Today, we are welcoming Alicia Godsberg, who is the Assistant Director for Global Programs at UNICEF. She also is an expert in the area of WASH, water, sanitation, and hygiene. Alicia, thanks so much for joining us today. To kick off our conversation, I'd love to welcome you to tell us a little bit more about your background, one thing we might not know about UNICEF, as well as something that drew you to the mission of UNICEF.
Sure, thank you so much. It's nice to talk with you today about UNICEF's WASH programming. As you mentioned, I'm the Assistant Director of Global Programs at UNICEF USA, and I've been with the organization for over 4 years now. One of the areas I work in is water, sanitation, and hygiene, and so I'm happy to talk with you about UNICEF's WASH programs. One thing I'd like people to know about UNICEF that they might not know is that it's a humanitarian and development agency and not a typical charity in the way that we think of charities. And what that means is, in the first instance, UNICEF is on the ground before, during, and after an emergency. And then in the second development context, it means that UNICEF works for sustainable change. So not just building a well, but strengthening water systems so that children's rights are protected. Another important thing about UNICEF that people might not know is that UNICEF works with governments, all types of governments, and it's an apolitical agency. And that's why UNICEF is able to create sustainable change, because that's only possible working with governments. And as far as what drew me to UNICEF's mission, I think the biggest thing was how UNICEF kind of looks at the child holistically. So they don't just sort of focus in on one aspect of something that might need support, like health systems or water and sanitation, but they see the connections. They see how Safe WASH is connected to nutrition and education and health, and they treat support that way, in a holistic way. And also the sustainability aspect. I really appreciate how UNICEF works on the systems level to create sustainable change.
Thanks so much, Alicia. So today we are talking on Zoom as a result of the current COVID-19 pandemic. We'd love to hear a little bit more from you about how UNICEF is responding and how your work has changed over the last 8 months, given the evolution of the virus.
Yeah, everybody's work has changed a lot, I think. UNICEF USA, our offices across the country went remote starting in mid-March, and we don't anticipate opening back up until July, at least July 2021 at this point. And UNICEF, similarly, the work on the ground in every single country has been affected by COVID-19, including routine services like providing immunizations for children against preventable diseases. But UNICEF hasn't just had to adjust to the virus itself, but the secondary effects of the virus on children have been really enormous. So things like the disruption of education, closing of schools, loss of income, which leads to increased poverty and protection and nutrition issues. Just as an example, in April, when the virus's first wave was really coming around, school closures affected 90% of children around the world. That's 1.5 billion school children. And UNICEF, is on the forefront of ensuring that children get learning materials no matter where they are, even if they don't have digital technology or connectivity to the internet. In some cases, they don't even have access to radios to learn. So UNICEF has really been challenged to make sure that children still have some learning opportunities. And then, of course, UNICEF is an organization that works in the field, but countries have been in lockdown and there have been travel restrictions. So not only do UNICEF colleagues have to reimagine certain things like trainings for healthcare workers that have to go online, but they also have to make sure that they themselves stay safe during the pandemic. Most recently, UNICEF was chosen as the lead agency for COVAX, which is what they're calling the COVID vaccine response. And that is basically in charge of procuring, preparedness, and delivery of not only vaccines, but testing and treatments, as well as supporting in-country readiness to deliver all of this. And that's really because UNICEF is uniquely positioned, working in all places around the world, with supply warehouses all around the world, positioned with supplies, and with the experience of working to reach even the most vulnerable children wherever they are. So UNICEF really is going to have a very important role to play as treatments and vaccines are rolled out across the globe.
Thanks. And in thinking a little bit further about COVID-19 and your expertise in the area of WASH, can you tell us a little bit more about how these two connect? And can you illustrate for us an example of a success story that UNICEF has seen in this area?
Yeah, sure. So UNICEF's WASH program is one of its biggest programs. It's part of the fourth goal area in the UNICEF strategic plan, which is that every child lives in a safe and clean environment. And just to give you an idea of the scope of the UNICEF WASH program, last year in 2019, it helped over 57 million people gain access to WASH services through both development and emergency programs. And they have an ambitious goal in their WASH strategic plan, which is by 2030, that everyone, no matter where they are, will have access to safe water and sanitation services. And COVID has really put a spotlight on how important WASH is for health. For example, hand washing in particular is really so closely linked with prevention and control of infections. And this is so incredibly important because we know even today, more than 700 children die every single day from diseases that are related to unsafe wash. So we understand the importance of infection prevention and control and hygiene and how that's all linked to staying safe from COVID. But, around the world, people don't have access to safe water. They don't have access to soap. For example, even before the pandemic, we know that 3 billion people around the world don't have soap and water at home to wash their hands. And 40% of healthcare facilities around the world don't have hygiene facilities at the point of care. So, that really illustrates the connection of health and WASH and preventing COVID-19. But UNICEF has really been responding. And to date, they've reached more than 73 million people with critical WASH supplies, including hygiene items, in 118 countries. And they've trained 3 million healthcare facility staff and community health workers on infection prevention and control. And we can look to India for a really good concrete example of how UNICEF is working in the field. So since March in India, UNICEF has been consistently reaching more than 35 million people every month with messages around COVID-19 prevention and access to services. 3.6 million people have already been reached with critical WASH supplies. And also in October, the government launched what they're calling a 100-day campaign to provide safe drinking water to all schools as part of the effort to reopen schools safely. And UNICEF was the biggest partner in developing and planning and rolling out this project. And just as one more concrete example from the region, in Pakistan, UNICEF helped rehabilitate and install WASH facilities in more than 500 healthcare facilities, which reaches more than 1.4 million people.
Thank you, Alicia. In my own community, I've been awed by the resiliency of the people that I see around me, whether it's children who are adjusting to changes in their education, or whether it's adults just navigating how to go to work and how to care for their families every day. I'm curious, as you think about resiliency, what have you personally learned over the past several months as it relates to where we are right now?
That's a great question. I mean, resiliency means so many things, but it definitely comes across in so many ways. Like, for example, my colleagues at UNICEF USA, we've adapted to this remote working environment where we're continuing to fundraise. In fact, I mean, we have our upcoming Changemakers event. We've already raised so much money for UNICEF before the event in December 1st. And advocacy continues. So we all know how challenging remote work can be, but I'm amazed by how well everybody has sort of adapted. And also really impressed with the UNICEF colleagues around the world, especially those in the field. As part of my work, I talk to them every day. You know, I'm on the phone, Zooming with people around the world, and how they're adapting to doing this important work for the rights of children in the midst of this pandemic with travel restrictions, hotspots, and the increasing toll that those like secondary effects we talked about are taking. Even as like the systems that are meant to support these children are weakened, is really impressive and humbling. And I think as an organization, UNICEF is approaching resilience through what they're calling their Reimagine campaign. So this is envisioning building back better after the pandemic, whether it's resilient infrastructure against the effects of climate change, or improving mental health services and ensuring that children with disabilities don't get left behind. I think as an organization, UNICEF is really taking this idea of resilience and expanding it to make sure that we don't go back to what we had. We go back and we put ourselves on a better footing to be more resilient to whatever shocks there are in the future.
Thanks, Alicia. I just want to say that hearing so much about UNICEF's work really gives me a sense of hope and inspiration for our future. I want to thank you for everything that you and your colleagues are doing to help ensure a brighter future for our children. And I want to thank you for taking the time today to share more about UNICEF's life-saving work. Thanks so much.
Thank you so much for having me.
That's all for today's Charity Voices series. Thank you so much for joining. Stay up to date on the work of all of our wonderful charity partners by following Global Impact on Facebook and Twitter, and visiting our website, charity.org/give.